manifestations of Point-Gigas syndromes from the perspective also of a gastroenterologist can be rather diverse. So first of all, if we could just take a look at the patient itself, it can be symptoms. So just symptoms of an anemia, of a blood loss. That means the patient has a shortness of breath. He's not durable as much as he would have been. He feels fatigue, so he's really tired, and this might be a problem. So the blood loss comes typically from polyps, from large polyps which have lost their mucosal integrity, and they just lose continuously blood via the stool, so via bowel movements. And typically patients don't realize that, they don't see that. And that's normal because it's a continuous blood loss, and it's just not at one at a time. So this might be one of the first symptoms patients can have. Another symptom might be the symptom of intussusception or invagination, which is like telescoping of the small bowel. And this leads to, severe abdominal pain, and this can be a real emergency. Patients have vomiting at that point, don't have any bowel movements, and this is a typical high-risk emergency. The risk of invagination or intussusception depends on the polyp burden. So if there are many large polyps in the small bowel, the risk of invagination or intussusception is definitely higher. So this is typically one of the primary manifestations of the disease, and after that we try to prevent that by performing polypectomy, by performing endoscopy to get rid of the large polyps which can cause all the problems and all the harms for the patient. If we have a non-symptomatic child by the age of 8, we would start with the endoscopy, with an endoscopist and examination, as well as the capsule endoscopy. So we would perform an upper GI endoscopy. We always use in Point-Gigas patient for the upper GI endoscopy not a typically gastroscope, which is rather short. We use a colonoscope, a pediatric colonoscope, so we can also inspect the jejunum, at least part of the jejunum as well. So this is the middle part of the small bowel. And then we also perform a colonoscopy, where we always also inspect the distal ileum, which is also one of the reasons or one of the locations where polyps can occur. And then we perform the small bowel endoscopy. But it's different, for example, in a symptomatic child. For example, we had a 3-year-old he had consistently a lot of loss of blood, and he had a 5 centimeter large polyp in the rectum. So we endoscopically resected the polyp, and after that we didn't have to see him for 3 additional more years. So you have really to stratify which polyp you need to resect, and we know that, for example, regarding cancer risk and also regarding problems a polyp might cause, we have a threshold after the size of 10 millimeters, the risk of getting cancer or getting local problems in that polyp is higher. So we try to get rid of all polyps which are larger than a centimeter, and also every polyp which looks inflamed, so which has really an inflammation in it. So we try to endoscopically resect these polyps. So the sheer polyp number doesn't give you a really hint how high the risk is. So as I said before, it's not about polyp numbers. It can be, you can have 100 small polyps, doesn't matter. But if you have 5 large ones, these really matter. Point-Gigas patients, my first aim is that they will never meet a surgeon. I love our surgeons, but I think from a patient perspective, it's not the way it's supposed to be. So this is that we have a rather conservative approach. This is one of my first aims. Then the second one is, right now we have surveillance stratified by somehow clinical meanings, which really we don't really know if that's really needed, yes or no. So we want to stratify patients according to their cancer risk and also due to their symptomatic risk, so that we don't have under surveilled patients or over surveilled patients, because it's always an invasive procedure. Next, one of the aims would be that we try to get rid of invasive procedures, somehow manage patients conservatively by having good preventive measures. This can be either a drug or any other devices which can really help for the future. This would be the perspective we want to have.